Everybody. My name is Robert Rout. I am the Partnership Manager at Xyla Health and Wellbeing. So what I'm going to be talking about is the Healthy EU NHS Diabetes Prevention Programme. So very briefly, just a quick recap over the service. So the service is commissioned via NHS England. So the programme first commenced in 2016, and Xyla Health and Wellbeing are currently one of 5 providers across England. But more importantly, we are the provider currently across Northwest London. So the service is an absolute free service available for those that are eligible to join, and we will cover those eligibility criteria later on in this presentation. But pre-diabetes is a relatively new term. It's not a formal diagnosis. Your pre-diabetics aren't diabetic, and so there is a clear difference between the two. So what I'm just going to do first and foremost is just outline what pre-diabetes is. So diabetes and pre-diabetes is all about the relationship with the blood glucose, or otherwise referred to as blood sugar. And with those blood glucose levels being slightly higher than normal. So it's not got to the levels as to where you could say somebody is type 2 diabetic, but without lifestyle changes, the likelihood of them going on to develop type 2 diabetes is extremely high. So whilst pre-diabetes isn't a condition in itself, it's a range of risks which acts as a warning to us that our bodies are beginning to struggle to manage our blood glucose levels, and without changes being made to our lifestyles, we are likely to go on to develop the condition. So some signs and symptoms, so what to look out for. Now, the signs and symptoms that we're going to go for, now this list is not exhaustive, this is not all of the signs and symptoms, but some more of the common signs and symptoms that pre-diabetics might experience. So some of the key symptoms we might experience are frequent urination, excessive thirst, weakness and drowsiness, or blurred vision. But what's really interesting is that everyone will experience these symptoms at different stages. Some people might experience these symptoms quite early on when they're at risk of developing type 2 diabetes, whereas others who have type 2 diabetes might take years to develop these symptoms. But also some people may never experience them at all. And that's why many people could be living with the condition, but they don't know about it. We could look out for, as they may be a sign that we may be at risk of developing type 2 diabetes. And more importantly, if you are experiencing any of these signs and symptoms, please visit your GP. This itself, as expected at this moment in time, is done remotely in the new digital age. So at this moment in time, due to the pandemic, the service is still being offered, but remotely through groups or via digital service. So we have our Microsoft Teams group sessions. So for those of you that like to use smartphones, have access to computers, etc., then you will be able to join onto our groups via Microsoft Teams. Those of you that do not have access to a smartphone or a laptop, do not worry, because we can still conduct our service over the telephone. So we do use a telephone conference line to also deliver our service. And then the other arm of our program is the digital offer, and this is provided by our partner in Oviva. So the digital offer, you will need access to a smartphone or a computer of some sort, where you can then access their app and their online account, where you can then complete online learning modules. So all of our patients have the choice between these options here. So you will be offered these choices upon registration. So if you do refer into our service, you will have the option of all 3 of these pathways. A little bit more information now about our group sessions. So group sessions, just to reiterate, is referring to our MS Teams and our telephone conference line. So your referral will be picked up by our patient support team, and then they will end up booking you into a group. Now, these groups are held at all various times of the day. So we do have morning, afternoon, evening, and we also have weekend groups as well. So the first phase of the program will be the initial assessment, and this is performed by our central health coaching team. And essentially, they will ask you some simple questions, some demographic questions, and they'll also provide you some information and background on the program, and then basically start your journey by going through some goal settings. Group sessions. Now, there are 13 group sessions in total, and we'll develop a better knowledge and understanding of those in a second, but the group sessions are held over 9 months. So essentially what we have is we have 6 fortnightly group sessions and then we have 7 monthly sessions. So 13 in total, all spread out over a 9-month period. And hopefully that will then bring about long-term behavioural change. Once you've completed the group sessions, you will then finish with a one-to-one end of program review. As your final check-in, we'll be able to signpost you to other services. So we have quite a comprehensive signposting pack. And essentially at this point, you will then be discharged from our service. Exploring just a little bit more detail about what you would expect to cover during our program. So there's 3 core modules that we cover. First one in the dominant section is our eating well, otherwise known as our nutrition-based content, and we have 5 of those sessions. Second element is our moving more, our physical activity based content. And then the final element, another 4 sessions called our taking charge, or otherwise our behavior change based content. So the program does look at lifestyle changes. Everything that, going back to a previous slide, those controllable factors that you and we as individuals have complete control over and can influence and change moving forward, and hopefully moving forward to live a healthier, happier life without the risk of type 2 diabetes. The digital service, now again, this does work completely different to our group service, but this is delivered again by Aviva. It goes along the lines of more of a one-to-one approach. So you'll be assigned a one-to-one health coach, and you'll have access in terms of via the app to send them messages, get their support, book yourself in for telephone calls. Then you also have some online learning resources that you'll need to complete throughout the program. But the best bit about the digital service is it's completely flexible and convenient to you. Okay, so you don't have to commit to a group at a certain day or time. You can complete your online learning material at a time that is completely flexible with yourself. Now, as a service as well, we do ensure that we cater for those where English is not your first language. So we do have coaches that are bilingual, and as a company, we can provide different languages, and also any resources that we have. We do have an array of resources, again, that's been translated into a variety of languages. So again, if English is not your first language, we will try and cater for that. So we do have many of groups running in the likes of Polish, Hindi, Urdu, for example. Now, why is the NDPP important? So you might be sitting at home watching this video going, well, what relevance does the NDPP have to me, or what benefits could I have from attending this service? Now, ultimately, one of the best benefits that you have is ultimately that reduced risk of developing type 2 diabetes. So the common blood test used to assess an individual's risk of diabetes is what we call HbA1c. Now, through previous research, what we have found is that majority of our service users will reduce their HbA1c reading by an average of 2.4 millimoles. So that really takes them that step back from going on to develop type 2 diabetes. With obviously the pressures that primary care have been under, especially throughout this pandemic, as individuals, if we take control of our lifestyle, make healthier choices, then hopefully that will also lead to yourselves having less hospital admissions and requiring fewer GP appointments. One of the other metrics that we do monitor though throughout the program is our service users' weight. Now, not all of our service users need to lose weight, so please bear that in mind. It is all about weight management, and weight management can be weight reduction or maintaining a healthy weight. But for those service users that do need to lose weight, we do find that there is quite a good average weight loss throughout our program, roughly around about 4 kilogram average weight reduction from start to finish, with 79% of our service users reducing weight come the end of the service. Now, moving on to probably one of the most important parts of this presentation, and that is how to access the National Diabetes Prevention Programme. So first and foremost, we do have an eligibility criteria. So it's quite straightforward though. So if you are 18 years of over and you are registered with a GP practice in Northwest London, if you have an HbA1c reading between 42 and 47.9, or a fasting plasma glucose result between 5.5 and 6.9 within the last 24 months, you can get referred into our service. Now, there is an extension to this eligibility criteria, and that's for those who have a history of gestational diabetes. So if you do have a history of gestational diabetes and you have a normal blood reading, you are still able to access our service. So please bear that in mind. It's not actually slightly contradicting the above statement, but you can actually have a normal blood reading. But as long as you have a history of gestational diabetes, you can still be referred into our service. But what's really important, though, is that you can't be pregnant at the time of your referral. So in terms of accessing the service, there's two primary pathways into our service. The first one is through primary care or your GP. As mentioned earlier, if you are experiencing any of those signs and symptoms that we covered, then please visit your GP. If they do complete a blood test and you are found to be pre-diabetic, then simply ask your GP if they can refer you into the diabetes prevention program. Alternatively, using the web link on screen here at preventing-diabetes.co.uk, you can refer yourselves online. The second pathway in is via the Know Your Risk tool. So this tool is a simple, very quick, very easy quiz that you need to complete online. Again, this quiz can be found on our website, preventing-diabetes.co.uk, called Know Your Risk. It takes no more than 2 to 3 minutes, so no more than making a cup of tea. You can answer a few questions and find out your risk of developing type 2 diabetes. If you do score a score, could provide a score of 16 or above. So if you're at moderate or to high risk of developing type 2 diabetes, that's when again you'll be prompted about the NDPP service, and you can self-refer again online. So thank you very much for listening to this presentation. Again, for further information about our service, please visit preventing-diabetes.co.uk. Take care. Bye-bye.
So welcome to the Rewind engagement session. My name is Salma. I am a dietitian by background, and I will be talking about this exciting new program called Rewind today. So Rewind stands for Reducing Weight with Intensive Dietary Support. And today we're going to be giving you a little bit more detail about the program, those of you who are eligible for the program, and how to be referred onto the program. We also have a session at the end of the program for you to ask some questions. So please bear with us and we will allow you some time at the end of the day to ask some questions. So why Rewind? Rewind is an exciting new weight loss program that offers intensive weight loss, reduces your diabetes medicines, and even help to achieve remission of type 2 diabetes. This can be done by giving you advice on healthy eating, lifestyle changes, and physical activity advice. So, are you eligible to join the Rewind program? The Rewind program is for those individuals with type 2 diabetes above the age of 18, who have had type 2 diabetes for duration of less than 12 years, and have had a blood test in the last year. Anybody on insulin, planning a pregnancy, or is pregnant will not be eligible to join the program. I would like to now hand you over to my colleague Andrea, who will be giving you a little bit more detail about the Rewind program.
Thank you, Salma. Hello, my name's Andrea and I coordinate the Rewind program for the provider UK ICS. So I'm just going to tell you a little bit about the Rewind program. It's a unique blended approach which offers intensive support for weight loss. The program lasts for 1 year, over which time there will be 3 stages when you will be supported by UK ICS health coaches and our diabetes practitioners. During this year, you will have 10 group sessions, which are currently being carried out over Microsoft Teams, 10 phone calls with your health coach, 26 online modules which support the learning from your group sessions, and regular appointments with your healthcare professional. There are 2 pathways for Rewind. Research shows that the greatest weight loss is achieved by following the total diet replacement pathway. However, if you're not eligible for the total diet replacement pathway, you can choose the low carbohydrate diet pathway. Here is some feedback we've had from patients who have been on the Rewind programme.
What went well is I've been struggling with this weight for a long time, and I never ever thought the scale would ever move. And the day I went on the scale, and it's always been like 84, 82. And when I went on the scale and it literally shifted, I thought, oh my gosh, this is really working. And so that really made me happy. And so every time I go I weigh myself, it would go less and less. And so that's encouraged me even more to stick with it, because for once, something was actually working for me. And so because it was working, I was more motivated and I really pushed myself to do this. So the weight loss was amazing.
It's been fantastic for me. It's worked for me. I'm very much committed to doing it, and the results have been very encouraging. I'm 3 weeks into the programme now. I've lost 21 pounds, 25% of the way through the programme. So I think it's only going in the right direction. So I'm very pleased. I'm currently not taking the medication, and at the end of the programme, I hope not to be continuing with it in the future.
I started with 87 kgs. Now I'm 76 as of today. So I've lost 11 kgs.
Thank you, Andrea. We're now going to show you a quick pathway of how you can join the Rewind programme. So once you've decided about joining the Rewind programme, it will be a good opportunity for you to talk to your healthcare professionals at your GP practice in order to check which pathway which would best suit you and sign up for the programme. Once your GP practice has agreed on which programme suits you, they will send a referral to UKICS. UKICS will then contact you via the phone and talk to you about the start date of the programme. They will also advise you on how to order the total diet replacement products. Once you have agreed the start date of the programme, your GP practice will arrange a telephone conversation in order for you to stop some of your diabetes and blood pressure medication. This can be done with anybody in the practice, including your nurse or your practice pharmacist. When you are starting your programme, you will need to stop your medication on day 1 as agreed by your healthcare professional team. Once you've started the programme, your healthcare professional team at your GP practice will continue to monitor your blood pressure and your blood glucose levels on a weekly basis. This can be done remotely once they have offered you your blood glucose monitor as well as a blood pressure monitor as well. They will continue to offer you to support over the phone. For further information about the Rewind programme and other type 2 diabetes eating plans, you can visit our No Diabetes website and also look up information on the Rewind programme. We would also like to share with you some new cultural resources we have developed for ethnic minority communities living in North West London. This particular site includes information on intermittent fasting, low carbohydrate diets, and prevention of type 2 diabetes. It also includes a range of videos, documents, and language-specific resources. We've also created 7-day meal plans for multiple communities, and these include Arabic, Caribbean, South Asian, and West African low carbohydrate meal plans. You can download these recipes from our website today. Thank you for listening, and if you have any questions about the Rewind programme, you can contact the Rewind team on 0333 577 3561 or email them at rewind@icshealth.co.uk. Thank you very much.
Thank you.
My name's Dr. Joan St. John. I'm a doctor with a a specialist interest in diabetes. I've worked in general practice for many decades. Here today, absolute pleasure to be here today with my co-author of the book Carbs and Cows World Foods, who is Salma Mehars, who is a consultant dietitian, and Salma will introduce herself.
So my name is Salma Meher. I'm a consultant dietitian. I have a special interest in diabetes care and management. Today I'm here to talk about a new book that I have co-authored with Dr. Joan St. John, and it is the World Food Book, which is one of the first of its kind to represent many cultural foods for the communities that we serve in Northwest London. And we're going to share with you our journey to how we got to develop the book together.
So I remember that I had the idea of how we could translate information in an understandable way to people who were living with mainly type 2 diabetes, because having worked as a GP for many decades, oftentimes there seemed to be a mismatch between people's blood glucose levels and their understanding of what might affect their blood glucose levels. And I'm sure it's the case with you as it is with me. You know, if we had a pound for every time somebody said, I don't eat sugar, and I don't understand why the blood glucose levels are high, we'd be rich, and we're not rich. So for me, it started in the consulting room. It started in those conversations with people who are living with diabetes, and people repeatedly saying to me they didn't understand why their blood glucose levels were raised. And I think together at the beginning, our mission was to try and convey a message in a way that people would understand very clearly and easily. And as you said, in Northwest London, we are really privileged to have such a rich diversity of people. And we wanted that whole diversity of people and communities and populations to be able to understand the message, whatever community they came from.
So I remember getting involved with this project with Joan about 8 years ago, and we decided to start capturing the images of all the common foods that we were eating between the two of us. So very fortunate I have a South Asian background and Joan has a Caribbean background, and the two of us, we started taking the images from our cameras and started collecting a library of photos. That then extended out to start taking photos of more and more foods that we were then recognizing locally in restaurants, in the local groceries, and a lot of our local fresh supermarkets, fresh markets. And we started collecting a library of foods. This then generated a lot of interest in how we could capture these images into a book or a small resource for our community and the people that we serve in our clinics. And we've realized that just by showing some of the images that we had captured of the different portions, so showing people the different portions of rice, not having any significant values or calorific values to it, just showing them the different portions was just a light bulb moment for engagement in our clinics. And we saw that when people recognized that we knew the type of foods that they were eating, they were just surprised and really pleased to see that we were engaging with them on something as simple as food, because food is something which is very important to everybody's life, you know, whether it's your everyday meal or whether it's a celebration. Diwali, you know, we had pictured a lot of the Indian sweets such as jalebis, gulab jamuns, and we had shown people the different portions that they could be eating. And it was really, you know, a light bulb moment. And Joan will share with you when we talk to people about this is what you should be eating. And when people tell you how much they're eating, it's a great way to engage with people in clinic. And I think that's when we realized that there is a huge need for this sort of work. And then we took our plea to organizations such as Northwest London Transformation Programme, where our journey began. So I'm going to let Joan speak to you how we started the official journey.
And if I can build on what you said, I think we understood, as I said, from the consultations, I understood that there was a need, but I don't think we realised how great that need was until we started actually exploring and doing this work. As a healthcare professional trying to serve communities, it was absolutely amazing to see, you know, have those moments with people. So we actually did a pilot study because within medicine, there's very little that you can do for communities if you don't show evidence of it working. And the evidence was really dramatic, significantly improving people's knowledge, their understanding, and their confidence about knowing which particular foods, snacks, drinks could affect their blood glucose levels. So we had gone from people not being able to make that connection to massively increasing people's knowledge and understanding and confidence in being able to make that connection. And the importance of that is that people could then be in a better position to self-manage their condition. And that's what we want to do always, is to empower people, to enable them to self-manage. But if you were from these communities, if you're from the Black community, the South Asian community, other ethnic minority communities, you didn't have that information to hand in order to empower you and enable you to self-manage. I think Carbs and Cows have done some absolutely tremendous work in this field, and they were able to introduce people to the concept of carbohydrates, and the carbohydrates are very commonly eaten foods, but that was commonly eaten foods for the majority population, which is tremendous. It was absolutely fantastic. And what we wanted to do was to push that further so that we could enable all people to have access to that information.
The key sort of, I would say, driver in this were the people living from with type 2 diabetes from the community. We're very grateful to the individuals who reached out to us, worked with us, and were able to give us the correct advice in terms of the different types of foods, the different types of drinks, even supporting us with preparing a lot of the foods that we've listed in the book. So it is very much a co-design with the communities that we have shown in the book. So if you have had a chance to look at the book, we have sectioned the book into different communities, starting off with the Arabic community, the African community, where we've listed the common staple foods in their diet, starting off with the different type of basic carbohydrates for breakfast, lunch, and dinner. We then have showcased it in different portions, and all the work that we've done was with people from these communities who actually showed us how the food is prepared, how the food is served, and also how because there's no guidance on portions, so they would give us advice on what a large portion would look like, and then we would have to work our way in terms of determining small and medium as well. So we've actually shown the actual foods in such a way that are much realistic to people who would be looking at these images, in terms of how they would be preparing the food at home, how they would be cooking the food, and also what is actually a normal portion for a lot of the communities. So anybody who would benefit from the understanding of better carbohydrate awareness, if you want to improve the understanding of what foods impact your blood glucose the most, so whether you are living with type 2 diabetes, type 1 diabetes, and you want a better understanding of which foods have carbohydrates and how they impact your blood glucose, the World Food Book is one of the simplest ways of understanding that. It also will benefit people who are trying to prevent the onset of type 2 diabetes by understanding which foods have the most impact on their blood glucose by trying to lower the amount of carbohydrates in their diet. We know from lots of evidence and studies that have been coming out recently that lowering the amount of carbohydrates from your food, and that doesn't necessarily mean if you stop eating sweets and sugars, that is what's going to help. But it's also foods such as, our staple foods such as rice, potato, pasta, yam, cassava, fufu. If we're making a lot of flour-based foods or pounding a lot of flours, I think all these foods, people, it's really useful to have the understanding of how much carbohydrate is in what you're eating and how it impacts your blood glucose. And once you've understood this simple concept, I think it is something that you will keep with you for the rest of your life, because once it's embedded into you, the simple messages, you can then use that in your everyday cooking, in your everyday living, whether you're eating at home, whether you're eating out, you have that understanding of carbohydrates. And that is what the benefit of this book is. So anybody who would like better understanding, so it's not just for people living with type 2 diabetes or type 1 diabetes, it's also for people who are in the healthcare setting. So anybody like myself and Joan, looking after people with diabetes, whether you are in a clinic setting or a care home setting or a hospital setting or even a school setting, the book will actually give you very good understanding of which food is going to and how much it is going to impact your blood glucose, what are the alternative options, and what education messages you can give. So
important to say also that we celebrate the foods. You know, we're not denigrating the foods. These foods are traditional foods for the communities. They are something that is nutritionally complete. But if people don't have the full knowledge of how it might impact them, let's say if they're living with type 2 diabetes or at risk of developing type 2 diabetes, then they're disempowered. And what we want to do is to empower them to make their food choices on the basis of the information, you know, being there accessible to them.
World Diabetes Day is to celebrate diabetes care across the globe. And I think the World Food Book does bring something very special to World Diabetes Day, and said that it's different. It's something which is very unique, and it reflects on people across the globe. So I think the International Diabetes Federation would be very much interested in the work that we're doing locally, nationally, promoting the simple message of food and diabetes management, which has sparked so much interest. So I'm really pleased that, you know, we are still here speaking about this passionately. We will continue to do so, and I think we still have a long journey together with to promote the book.
My name is Dina. I am a community health educator. Community health educators are part of Brent Health Matter program. We work within our local communities. We try to raise awareness about different health issues, and we try to address health inequalities within certain communities. Our current focus is on diabetes because it's highly rising in Brent, particularly type 2. We let them know about the early prevention program and how to reduce the long-term complications that might result from having diabetes. We are the link between the community and the health partnership.
Hi, I'm Nazia. I'm a community health educator. We, as health educator, we basically plan and deliver health messages in the community by engaging with individuals, families, and community organizations, where we do organize talks, workshops, stalls in different community settings. It could be libraries, community wellbeing centers, schools, parks. So we, as community health educators, also we respond to the health queries and questions from the community, and we do signpost them to the right health services. Like we have for the diabetes, we have diabetes prevention program, national diabetes prevention programs. We do have Brent Health Matters helpline advice numbers. So these are the ways we try to engage and help the community as much as possible. So basically we try to incorporate positive and healthy habits in people, and we do help to create and distribute health education information like leaflets, flyers, in the community wherever we arrange, talks.
You can contact us on the email below.
My name is Ken Morkiwas. I'm one of the nurse specialists at Brent Health Matters. I work with the GP surgery, supporting them with managing and assisting them with their patients. Uh, 5 years ago, I was diagnosed type 2 diabetes. They prescribed me medication to manage my diabetes. The only thing is I wasn't totally doing my part as a patient. My diet wasn't really manageable as a diabetic patient, including my hypertension. They have to manage my blood pressure medication as well. I have a family background of diabetes, with my mom being diabetic. My BMI was over 30, so I was really a high risk of diabetes. And, due to my working hours, like 12-hour shift, sometimes skip my medication, my prescribed medications, taking takeaways, no exercise during the week. Being Asian, I'm fond of eating rice like mostly twice a day. So lots of carbohydrates in a meal. I wasn't managing really. So the doctors have to increase my medication. As I said, 5 years ago, it was a big shock for me being a nurse diagnosed with diabetes. I know it runs in the family, but I really struggled, nearly to the point of being so stressed, even with the family. But I've done my best doing a lifestyle change, which wasn't easy. As I said, diet is very important, and exercise. My family is now involved with my diet, and my youngest son, we do basketball and boxing. So my wife really supported me with my diet. She's now ordered me loads of protein and milkshakes to replace my meal. All vegetables in the fridge now. I mean, the things I used to buy, it's all changed with healthy alternatives. Even drinks, we don't drink anymore fizzy. It's all like natural. Initially, with the GP support, when you're newly diagnosed, or even prevention of having diagnosed with diabetes, I think it's best with professional advice initially. But it was really helpful for me having the diet change, lifestyle change, exercise, and involving the family, managing the diabetes. I think it's really very important to have your vaccine, COVID vaccine and flu, because you're more vulnerable to having illness if you're diabetic.